evening and welcome to another episode of the program Easy Access to Healthcare for All, a program that brings you updates on the activities and happenings around the National Health Insurance Scheme and the health insurance space at large. Our focus in this episode is the recent onboarding of core members into the National Health Insurance Scheme through the Group Individual and Family Social Health Insurance Program, GIFSHIP. We will recap the journey through the signing of the Memorandum of Understanding between the NHIS and the NYSC and go on to discuss some of what core members should expect by being registered into the GIFSHIP. And in our stakeholders segment, we'll bring you an interview with the NHIS zonal coordinator for the Lagos zone, where he speaks on issues around his terrain. I am Aisha Muhammad Ahmad, your regular anchor. Stay tuned for the full package coming your way after the break.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. In the news, NHIS holds budget validation workshop just as it trains human resource personnel to improve efficiency.
The National Health Insurance Scheme has organized a harmonization and validation meeting for its 2022 annual operational plan. This workshop had heads of departments and zonal coordinators in attendance. In her opening remarks, Mrs. Asma'u Mohammed, GM Planning and Statistics, said the essence of the workshop was to harmonize budgets and activities of the different departments in the scheme.
The objective of the workshop is to set a clear framework for the scheme's operations. It is to ensure that activities are in alignment with the NHIS 10-year strategic plan. It is to ensure that there's proper sequencing of activities and allocation of responsibility.
The various departments and zones presented their budget and activities, and they were harmonized towards achieving the set goals. Participants speak on the importance of the workshop.
We're here to harmonize our annual operational plan, and this is the first of its nature. Since our able executive secretary has come on board, we've had the 10-year strategic plan, and we have come here so that we can harmonize the activities and initiatives of the departments, the zones, and the state.
We are going to ensure all activities that are going to be done in the NHIS are in complete alignment to the NHIS 10-year strategic plan. All activities and initiatives of the NHIS are better sequenced, better harmonized, and better aligned. And also we look at the resource dimensions to it, whether to share that whatever activity we do, is cost effective and that we get value for money for the activities we're implementing.
In line with the rebranding agenda of the present NHIS leadership, the scheme recently organized a workshop for staff of the Human Resources Department. The workshop is to help boost the capacity of staff in the scheme. Speaking at the event, Professor Sambo, Executive Secretary of the NHIS, said the training is in line with the rebranding agenda and will help put the scheme on the right path.
One of the cardinal things that we need to do, whether we like it or not, is to be able to professionalize the National Health Insurance Scheme, because it is a professional organization. And part of the mechanism of professionalizing the organization is to ensure that people that are within the organization have a career pathway. If I am an accountant, or if I am an economist, or if I am a business administrator who is supposed to be working in the finance balance, I work in that finance department and grow to become a general manager of finance. So that even if along the career pathway I had cause to leave the National Health Insurance Scheme, I will go wherever I go and fit in perfectly. If we don't do that, the NHIS will not be a credible organization. The NHIS will continue to be a hopeless organization.
The program followed with enlightening presentations to help put participants on the path to professionalism.
Verification, we use our reports of this visit. A lot about what is going on in NHIS.
Participants at the workshop bear their minds on the program.
Apart from bringing all the personnel, HR personnel together, we now know our specific schedule of duty. Not that we didn't know before, but in a very explicit mood. So everyone knows what to do as you get back to your various states, branches and all that. Really good, very enlightening.
With this training program now, we'll be able to grasp, because there was a new posting released, new organogram. So it will enable us to now go back to our state offices and implement and drive towards the achievement of universal health coverage and efficient services for our organization.
Welcome back. The enrollment of NYSC members into the GIFSHIP of the NHIS is the fulfillment of a promise and a huge step towards attaining universal health scheme. How was it received? What exactly do core members benefit, and what happens when they exit the scheme? These and more are the issues coming up next. Don't go away yet.
Easy access to quality healthcare for all. NHIS.
Tuesday, 7th September 2021, the National Youth Service Corps signed a Memorandum of Understanding with the National Health Insurance Scheme (NHIS) on the inclusion of corps members into the scheme. Before the signing, the Director General of the NYSC, Brigadier General Shuaibu Ibrahim, said the MOU is in line with President Muhammadu Buhari's directive that all corps members be enrolled into the scheme with a view to cushion their health needs in their different states of service.
History is being made, and I know what it takes as a historian for this opportunity given to us by the President to enroll our corps members in this program. It's an indication of the concern of the federal government for the welfare of corps members, and also an indication that the federal government also appreciates what the corps members are doing.
While addressing his guests on that day, the Executive Secretary of the NHIS, Professor Muhammad Nasir Sambo, said it is the vision of the NHIS to see that every Nigerian is included in the healthcare delivery plan of the federal government.
As it is currently, the law establishing the National Health Insurance Scheme is not mandatory. And anywhere in the world where a universal health coverage is realized, you realize that the law establishing the health insurance is made mandatory. But unfortunately, ours in 1999, when it came out, it was non-mandatory. But we have worked assiduously in collaboration with the National Assembly, and that law has been reviewed and awaiting presidential assent. By the time we have the President assented to the bill, we will now have a very clear pathway for attainment of universal health coverage.
Following the signing of the MOU, the official flag-off of enrollment of corps members into the scheme under the platform of the GIFSHIP was formally kicked off in February 2022. The event was graced by dignitaries and stakeholders in the health sector.
This initiative is indeed a bold...
Speaking at the event, Professor Nasir Sambo, Executive Secretary NHIS, said the initiative was a bold move in the right direction, given that it would contribute significantly to the well-being and welfare of youths.
It is also important to underscore that investment in the well-being and welfare of young people is one of the most critical things that we can do as a responsible nation. It is our patriotic duty as individuals and organizations to ensure that we make education, employment, and more importantly, quality healthcare available, accessible, and affordable to this group for several reasons.
Professor Sambo further said the program will bring succor to core members. He also said quite a lot has been put in place to develop a framework to enable the program work seamlessly.
We have been moving from a pillar to post to the Federal Ministry of Finance, and finally we were able in 2021 to get the approval and inclusion of the funding for the NYSC coverage. And the funding of this coverage was granted in August 2021, and we continue to move to ensure that we have a credible system that will navigate this program.
While speaking during the onboarding ceremony, the Director General of the NYSC, Major General Shuaibu Ibrahim, said the NYSC GIFSHIP has been designed as a holistic health insurance scheme that will run through service year.
That is, as soon as prospective core member picks up call-up letter, which is the instrument that qualifies him or her for admittance to the national service, until the end of his or her terminal leave, which is 3 weeks after disengagement from service. For effective implementation of this scheme, 6 health maintenance HMOs have been carefully selected after a competitive process, each 6 geopolitical zones, to ensure seamless arrangement devoid of encumbrances.
Major General Shuaibu Ibrahim described the initiative as a landmark achievement and watershed in the annals of the history of the NYSC. Core members during the ceremony expressed their joy over the initiative.
When I started serving, for 2 weeks during my course of service, I was home with fever, as I couldn't go to my place of primary assignment, and it affected productivity in the way in the company because I have a key role I play. I think with a scheme like this, that has been taken care of. If I fall sick, instead of going to buy the normal malaria drugs, every person buys, when you fall sick in Nigeria, it's either malaria or typhoid. You don't go to do tests or all those stuff. But with a scheme like this, I think productivity has been enhanced very well in the NYSC.
I think it's a good start that they started it now. The corpers are getting involved, and it's going to be a good start for them. I want to thank the DG for making this possible for the corpers to get involved in it, and it's going to go a long way. At least corpers will get the privilege to get health in cheaper form.
I think it's an opportunity that will help core members being able to subsidize treatment for themselves, and it's not everybody that have the opportunity to get free medical checkups and all. I think it's very, very essential to be able to check your health, and the program is good. Basically,
it's a nice one because even while growing up, my parents are civil servants, and I've been a beneficiary of this NHIS because I think they've implemented it for civil servants for a very long time. So now coming to this youth service and still finding it being implemented here, I think it's a new development. It's a good one, and it's going to really fly, and everybody we are going to benefit from it.
It's a nice scheme. I think it will enable the youth and to be able to stay safe, and I think to always know much about our health. It's a nice idea. It's a good thing.
The NYSC GIFSHIP program is designed to cover pre-orientation, orientation, primary assignment and terminal leave periods of the service year of core members and would terminate at the end of the service year. But what is the process for enrollment into the program?
Well, talking about enrollment, we are sharing data with NYSC. So it's not as if we are going to, even if you to pick the core members individually and enroll them. We are going to share data. There's going to be handshake between our ICT and the ICT, so that we'll be exchanging data seamlessly. And that's what we are doing. No, it's the NYSC will provide the data of all the enrolled or the mobilized core members, and we will pick it. We will give them NHIS number because based on the framework we develop, we're not going to give them any NHIS card. Their NYSC ID card still serves the purpose of the. So it's just a way just to transfer the data. We use the data to do our own administrative activities that's related to release of money to the HMOs and payment to providers.
Under the formal sector social health insurance scheme, beneficiaries make co-payment for drugs. Will this apply to core members under the NYSC GIFSHIP?
Yes, for now, we are saying that, but that is something that at a higher level policy we are still discussing. Yeah, because for co-payment for the drugs, we have said no co-payment. But for the other aspects of high-cost payments, like CT scan, MRI, we have not, for now, said they should not do the co-payment for such. That one is more or less cost-sharing, all right? But for co-payment for drugs, they are not supposed to pay. In fact, they are not expected to pay. We have taken it out. And even in addition, even under the NYSC program, if a lady gets pregnant, who's a married, gets pregnant and delivers the baby, the system will still take care of the baby for up to 12 weeks.
The NYSC GIFSHIP program is a laudable initiative and is fully funded by the federal government of Nigeria. Its sustainability is therefore guaranteed.
This program is fully funded by government. So the issue of sustainability is a question that we'll be referring to availability of funds from government. And this will be dependent on our ability to make the proposal when the budget it's been done. I know that when we are working for this, we are told to make sure that when they are doing the budget, that they will put it in the budget. So if you are talking in terms of sustainability, it's already guaranteed.
While interacting with journalists, the Executive Secretary of the NHIS spoke on what can happen to core members after their service year.
So they can migrate from NYSC to GIFSHIP program by paying the token that we are expected. And when they get employed, they will get into the formal sector program. If it is a public sector job, they are under public formal sector. If it is a private sector job, they will join the private sector formal sector program. And if they are self-employed, they can continue to be in the GIFSHIP, which is a program designed for self-employed.
Welcome back. Mr. Olufemi Akingbade is the zonal coordinator for the Lagos zone. As someone who has grown through the ranks in the National Health Insurance Scheme, Mr. Akingbade has a lot to say about health insurance. Our discussion with him as a stakeholder in the implementation of the NHIS centered around the Lagos zone. Mr. Akingbade explained the peculiarities of his zone and the significance of efforts put in place to reach even the suburbs of his terrain.
Lagos on its own is like a zone, and that is why we have the Lagos zone, because there are some places in Lagos that you have to travel far and wide. If you go to Epe, if you go to Badagry, if you go to Ikorodu, it's almost like a day's journey. But we are coping, because one of the things that we also have in Lagos, which is peculiar, is that Lagos State is the only state that has 2 state offices. And with those 2 state offices, we have distributed ourselves into the 20 local governments that are available in Lagos. Each of the states manage 10 local governments each. And with that, we are able to reach even the farthest places in Lagos. We have actually distributed the state into 2, and we have taken it even across the senatorial districts And with that, it is making an impact because we are able to reach them without putting so much burden on the existing staff that we have.
Bearing in mind that Lagos State has a large informal sector population, Mr. Akimbade says continuous efforts are being put in place to attain coverage.
Like I said, Lagos is peculiar, and one of the peculiarities of Lagos is that Lagos itself is actually moving forward to cover the informal sector. We are not in competition with Lagos State on any area. One of the things that the new executive secretary did when he came was to design what we call a matrix of cover. And in designing the matrix of cover, there's coverage for federal civil servants, there's coverage for people that are supposed to be multinationals and big conglomerates. And that is where we operate for now. And then Lagos State actually takes care of those that are state-owned institutions and then the organized private sector within Lagos State. But by and large, what we have done in Lagos State has the highest number of accredited healthcare facilities across the scheme. We have about 13,000 healthcare facilities, both public and private, that are accredited by NHIS. So it's such a large place. And in terms of enrollment also, we have done a very good work.
The new NHIS flagship program, GIFSHIP, is becoming quite popular with citizens of Lagos. Mr. Akingbade speaks on its acceptance in Lagos.
By the time the GIFSHIP came, initially one of the things that we had with the other program was we had a lot of adverse selection. People come in when they need health care, especially pregnant women. They come in when they need care, and immediately they deliver their baby, they disappear. They are educated, so they know how it works. But nowadays, because of the revamping that we have done for VCShip and turned it to GIFSHIP, GIFSHIP has put in some controls whereby a lot of people cannot just stroll in and stroll out. And the reception is quite nice because you find out that initially a lot of people didn't know about the program, but now they are starting to hear about the program. And because of the conditions that we have put into it, if you register, if you walk away, because of the tight loopholes that we have blocked, if you register and walk away, by the time you're coming back, you're going to pay for the gap of the time that you walk away. And they've realized now that the program is not only for the federal civil servants and individuals joining. We have a lot of groups that have joined in Lagos.
Mr. Akinbade speaks further on effective monitoring of healthcare providers and health maintenance organizations' activities within his zone.
They know that we are on their toes, so most times they try as much as possible to meet it. And where you see erring facilities, we actually sanction them. We've had instances where, I won't mention names here, but we've had instances where we have sanctioned some hospitals, either for wrong billing, either for wrong treatment, either for delay in services, either for denial of services. There are so many reasons why enrollees complain. And once they complain and we find out that you have erred, we make our recommendations. We warn you, and then we make our recommendations to the head office. And if there's need for you to be sanctioned, you're sanctioned.
That was Mr. Olufemi Akinbade, Zonal Coordinator, Lagos, speaking on various issues around the Lagos zone. We'll now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: how do enrollees access specialist care?
For specialist care, the enrollee will first attend at their primary provider, which in NHIS parlance we call the gatekeeper. So you go to your doctor where you have registered, and then the doctor, if sees anything necessary, will refer that enrollee for a secondary service. If the hospital offers that service, then there will be an internal referral. However, if the hospital does not offer that service, then it's referred to a center where that service is offered, and the hospital therefore in both cases, the hospital will actually get in touch with the health maintenance organization who will actually issue the referral code. And then the hospital gives the notification of the referral to the patient, who either goes to the internal place if the hospital offers the service, or goes to the other service provider that actually offers that specialty service.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
NHIS.
This is where we draw the curtains on this program today. Join us for another interesting episode again, same time and on this same station, as we continue to bring you more stories of happenings around the NHIS and the health insurance ecosystem at large. But if you do have inquiries or comments, send them to any of our feedback channels. Enjoy the rest of the evening.
Easy access to quality healthcare.